Hello everyone and welcome back to MediInsights. Today we will explain Bimatoprost Eye Drops in simple terms so you can understand why it is prescribed, how to use it safely, common side effects, and practical tips to discuss with your doctor or pharmacist, and what to watch for every day. Let's go over the main reasons doctors prescribe Bimatoprost Eye Drop. Bimatoprost eye drops are prescribed primarily to lower raised pressure inside the eye, a condition known as ocular hypertension. They are commonly used to treat open-angle glaucoma, which is the most frequent type of glaucoma. Lowering intraocular pressure helps reduce the risk of damage to the optic nerve and slows disease progression. Your doctor prescribes this medicine when other treatments are not enough or as a primary therapy. In a different formulation, Bimatoprost is also approved to treat hypotrichosis of the eyelashes, which means thin or sparse lashes. When used for lashes, the product is applied carefully to the skin along the base of the upper eyelashes, not into the eye itself. The eyelash formulation is a prescription cosmetic treatment and should be used only under medical advice. Using Bimatoprost for glaucoma versus cosmetic eyelash enhancement involves different concentrations and instructions, so follow the label and your prescriber. Bimatoprost should not be used without a prescription, and you should not share your drops with others. If you have questions about why it is chosen for your eye condition, ask your ophthalmologist to explain the expected benefits and alternatives. Follow your treatment plan and attend scheduled eye exams regularly. Now we'll explain the recommended dose and schedule. For glaucoma or ocular hypertension, the usual dose is 1 drop in the affected eye or eyes once daily in the evening. Do not use Bimatoprost more than once a day because more frequent dosing can lessen its effect. If you must use more than one topical eye medicine, wait at least 5 minutes between different drops. Remove soft contact lenses before instilling Bimatoprost and wait at least 15 minutes before reinserting lenses. The eyelash treatment is applied nightly to the skin at the base of the upper lashes using a sterile applicator, not into the eye. Follow the exact product instructions and your prescriber, since concentrations and directions differ between glaucoma and eyelash products. If you miss a dose, skip it if the next dose is near and do not double up to catch up. Your clinician will monitor intraocular pressure and may adjust therapy based on response and side effects. Tell your provider if you develop new redness, pain, or vision changes. Keep the bottle closed, store as instructed, and discard after the recommended period. A quick note on how Bimatoprost works at a basic level. Bimatoprost is a prostamide that is structurally related to prostaglandin F2-alpha, and it lowers intraocular pressure by increasing the outflow of aqueous humor from the eye. Most evidence shows that Bimatoprost increases uveoscleral outflow, which is an alternate pathway for fluid to leave the eye. Some studies also suggest that Bimatoprost can enhance conventional outflow through effects on the trabecular meshwork, although the exact contribution varies between studies. At a cellular level, Bimatoprost influences extracellular matrix remodeling and the behavior of trabecular and ciliary body cells, which helps fluid move out more easily. These changes can include alterations in matrix metalloproteinase activity and tissue structure that reduce resistance to aqueous flow. Because of these combined effects, Bimatoprost effectively lowers intraocular pressure in patients with open-angle glaucoma and ocular hypertension. The drug may also stimulate mild increases in aqueous humor flow in some circumstances, and its full pharmacology is still an area of active research. Understanding that the mechanism is partly complex helps explain why individual responses can differ, and why eye pressure is monitored after starting therapy. It works mainly in the eye and has minimal systemic absorption. This is why systemic effects are uncommon. It may cause reactions in some users. Here's what to expect. The most common local side effect of Bimatoprost is conjunctival hyperemia, which appears as redness of the eye. Many users also experience increased growth and darkening of eyelashes, which is desired in cosmetic use but may be unwanted for glaucoma patients. Bimatoprost can cause increased pigmentation of the iris and periocular skin, and the iris color change may be permanent. Some patients report eye irritation, burning, stinging, itching, dry eyes, or a sensation of a foreign body in the eye. Less commonly, patients may notice blurred vision, eye pain, or increased tearing. There have been reports of cystoid macular edema, particularly in aphakic or pseudophakic patients with a torn posterior lens capsule, or those with risk factors for macular edema. Rarely, changes in eyelid tissue and loss of periorbital fat have been described, which can alter eyelid contour. Because bimatoprost is applied from a multi-use bottle, there is a small risk of infection if the bottle becomes contaminated, so do not touch the tip to your eye. If you experience worsening vision, severe eye pain, or signs of infection, stop the drops and contact your eye care professional promptly. Systemic side effects are uncommon, but report any new symptoms to your provider. Last but not least, important advice for safe use. Wash your hands before handling the bottle to reduce the risk of infection. Avoid touching the bottle tip to your eye, eyelid, or any surface to prevent contamination. Tilt your head back or lie down. Pull down the lower eyelid to make a pocket, and place one drop into that pocket. Close your eyes for 1 to 2 minutes and press gently at the inner corner to help limit systemic absorption. Do not rub your eyes after applying the drops, and blot away extra fluid with a clean tissue. Remove contact lenses before installation and wait at least 15 minutes before putting lenses back in. Tell your eye doctor if you have a history of eye inflammation, herpetic eye disease, recent eye surgery, or risk factors for macular edema. Iris color changes and eyelid skin darkening can occur, and iris color change may be permanent, so discuss cosmetic risks with your provider. If you experience blurred vision, severe eye pain, or signs of infection, stop the drops and contact your eye care professional right away. Keep all follow-up appointments so your doctor can monitor your eye pressure and adjust treatment as needed. Thanks for watching MediInsights. If this video helped you, please subscribe for more clear medication guides and leave a comment with questions or topics you want us to cover next.